The World Health Organization, who has its roots dating back to the 1850s, when a series of international sanitary conferences were convened to address the spread of infectious diseases. Eventually, the WHO was formally established in 1948 as a specialized agency of the United Nations, with the ambitious goal of promoting health and well-being worldwide. From its beginnings, the WHO has played a central role in shaping global public health policy and coordinating international efforts to combat disease. Over the decades, the WHO has racked up an impressive list of achievements. Perhaps its most celebrated victory was the global eradication of smallpox, which was declared in 1980 after a decades-long vaccination campaign. The WHO has also played a pivotal role in containing other infectious diseases like polio, HIV/AIDS, and Ebola, while working to improve maternal and child health, promote healthy behaviors, and address emerging threats like non-communicable diseases. The WHO is governed by the World Health Assembly, which is composed of delegates from all 194 member states. The Assembly elects the organization's Director General, who serves as the Chief Administrative Officer. The WHO also has 6 regional offices around the world, each with its own regional director, to better coordinate efforts tailored to local needs. This decentralized structure has both advantages and drawbacks, as it can empower regional initiatives, but also lead to coordination challenges. One of the WHO core mandates is tackling communicable diseases, and it has spearheaded numerous successful campaigns over the years. The organization's Global Polio Eradication Initiative, for example, has reduced polio cases by over 99% since 1988. The WHO has also been at the forefront of the fight against HIV/AIDS, tuberculosis, and malaria, providing guidance, technical assistance, and funding to affected countries. Increasingly, the WHO has also turned its attention to non-communicable diseases like heart disease, cancer, and diabetes, which now account for the majority of global deaths. It has developed policy frameworks and intervention strategies to help countries address the rise of these chronic, lifestyle-related conditions. The organization also plays a key role in setting global standards and norms around everything from food safety to tobacco control. Environmental health is another critical area of the WHO work, as it recognizes the profound linkages between human well-being and the natural environment. The organization has championed initiatives to improve air quality, water and sanitation, and chemical safety, among other priorities. Its efforts to highlight the health impacts of climate change have also been increasingly prominent. When major health emergencies strike, the WHO is expected to coordinate the global response. This was evident during the COVID-19 pandemic, when the organization faced both praise and criticism for its handling of the crisis. The WHO has sought to learn from this experience and strengthen its capacity to rapidly mobilize resources, share information, and support countries in preparing for and responding to future pandemics. Achieving the WHO ambitious goals requires a vast network of partnerships, from other UN agencies to civil society organizations, philanthropic foundations, and the private sector. The organization has forged collaborations across a wide range of health issues, pooling expertise, resources, and political will to drive progress. However, managing these diverse partnerships can also be a delicate balancing act. The WHO has faced its share of challenges and criticisms over the years, from questions about its independence and decision-making processes to concerns about the equitable distribution of its resources. In recent years, the organization has also been accused of being too slow to respond to emergencies or overly deferential to geopolitical interests. As the WHO navigates an increasingly complex global health landscape, it must continually evolve to remain effective and responsive to the needs of its member states. Looking ahead, the WHO is poised to play an even more pivotal role in addressing emerging global health threats and inequities. Key priorities include strengthening pandemic preparedness, accelerating progress on non-communicable diseases, promoting sustainable development, and ensuring universal access to essential health services. By harnessing the power of science, partnership, and political will, the WHO aims to fulfill its founding vision of a healthier, more equitable world for all.